Morning. This is me U32865525. Today I am going to give presentation on the drug name vincristine sulfate. Let's start. Vincristine sulfate. What is vincristine sulfate? Vincristine sulfate is anti-cancer drug which is used during chemotherapy with other chemotherapy drugs in order to slow or stop the growth of cancer cells. It belongs to class of drugs called vinca alkaloids. It is used to treat various types of cancer and tumors, and vincristine binds to the microtubular proteins of the mitotic spindle which lead to crystallization of the microtubule, which can cause mitotic arrest or cell death. Here is the chemical structure of vincristine sulfate. Here is the pharmacokinetics of vincristine sulfate. The first one is absorption. It is administered intravenously, which directly enters the bloodstream for systematic distribution throughout the body. It is very fatal when it is given by other route, and its bioavailability approaching 100%. The second one is distribution. Up to 15 to 20 minutes of injection. Over 90% of the drug is distributed all over the body, including tissue and organs, where it remains tightly but not irreversibly bound. The protein binding ranges is about 75%. The third one is metabolism. Metabolites hepatidic, which occur in the liver by cytochrome P450 isoenzymes of the CYP3 subfamilies. And the fourth one is excretion. The main excretory organ is liver, where 80% of the metabolites is excreted through feces and 10 to 20% is excreted through urine, and its elimination half-life is 19 to 155 hours. Here is the pharmacodynamics of vincristine sulfate. Vincristine sulfate binds with the tubulin. Tubulin is a protein which is important for formation of microtubule within the cell. It prevents the polymerization process and stops microtubule formation from working properly. Microtubule are essential for separating chromosomes during cell division. Vincristine helps this process, which prevents growing and dividing of cell, which affect mitosis phase of cell cycle and causes mitotic arrest in metaphase. As a result, prevention of cancer cell in growing and replication. Here is physiological effect of vincristine sulfate. We can see the adverse effect of vincristine sulfate in the human employed, which include neurotoxicity, which causes paralysis, paresthesia, constipation, abdominal pain, urinary retention, and extravasation causes cellulitis, necrosis, rear risks of cardiac effect, which causes myocardial ischemia, myocardial infarction, and it also causes myelosuppression, which affect neutrophils. Interdisciplinary teams. It is scheduled for prescription only medicine, and these medicine pack are available in pharmacy, and it requires a prescription from authorized prescribers who are oncologists, professional healthcare specialists. And it is very important to counsel with oncologists, pediatricians, radiologists, and surgeons before administration to give a better result. And it also prevents the further risks by monitoring of neurotoxicity, overdose, extravasation, review drug interaction, and it also includes informed patient consent, risk versus benefit analysis, prioritize patient safety. It is very important to use precaution with the patient who have several disease such as bone marrow, depression, pulmonary disease, neurotoxic agent, etc. And vincristine should not be used for those patients who have no muscle disorders such as Charcot-Marie Tooth syndrome. And always check allergy with vincristine sulfate before administering. And exercise caution with grapefruit products. And never do intrathecal administration, which can result death, and use precaution with the pregnant women. Counseling. How to take vincristine sulfate. In order to reduce the risk of accidental intrathecal administration, always prepare vincristine in mini bag in 50 ml instead of directly syringe. Give it by intravenous infusion over 5 to 10 minutes. Always avoid extravasation. And here with the side effect, nausea, vomiting, venous irritation in the cannula site, urination problem, chest pain, myocardial ischemia, low blood count, cell count, numbness, tingling, burning pain. And after taking, advice not to breastfeed. Always monitor complete blood count and liver function. Monitor for depression, constipation. Advice not to plan for pregnancy. It's time to check the knowledge. Vincristine is indicated for hypertension, acute lymphoblastic leukemia, diabetes mellitus, osteoarthritis. Its answer is acute lymphoblastic leukemia. The second question is what is the recommended route of administration for vincristine sulfate? Oral, intramuscular, intrathecal, intravenous. The right answer is intravenous. Here is the references. Thank you.